Hello, everyone, and welcome to yet another powerful Speaker X session. And today we have a very dynamic personality as our Speaker X, someone who has really worked extremely hard to build his practice right from the scratch to an absolute dream practice level. Every dentist would inspire to, have this kind of practice, will dream of having this kind of practice. And someone who is a big believer in keeping yourself updated in every new things that's happening in dentistry. And he is one of our proud community member, a leader in Life Excel course, Dr. Vivekanand Chede. Sir, welcome to the Speaker X and your first thoughts.
Thank you for inviting me as a speaker, sir. Am I audible, sir?
Yes.
तो एक शेर से चालू करेंगे सर। बहते हुए पानी ने पत्थरों पर न जाने कितने निशान छोड़े हैं। बहते हुए पानी ने पत्थरों पर न जाने कितने निशान छोड़े हैं। अजीब बात तो यह है कि पत्थरों ने पानी पर एक भी निशान नहीं छोड़ा है। So keep on moving, keep on learning, keep on upgrading yourself. Be in this wonderful community. So I feel if you cannot run, jog, if you cannot jog, walk, if you cannot walk, crawl, but keep on moving. So thank you for inviting me as a speaker X. Thank you all of you for joining this wonderful community, and those who are attending today. Thank you very much.
Okay, wonderful. So please introduce yourself formally. Where are you from? How many years you are into practice? Whether you are a BDS, MDS, because everybody would like to know about you.
Hello everyone, myself Dr. Vivekanand Chede. I am practicing in Ahmednagar. It is a district in Maharashtra, and in Ahmednagar city, it is an outskirts area. It is Kedgaon. So I'm practicing since last 18 years for now. Initially, I started my practice in Pune, Vishrantwadi. For a few months, I practiced there, but one of my seniors was practicing in Kedgaon, so he was going to Australia. He handed over his practice to me. Shifting from Pune to Ahmednagar, everyone told me, "यार ये क्या कर रहा है तू? क्यों जा रहा है?" But one moment I thought I should take this chance, because getting a running practice and taking it to the next level is big challenge for me, and working in a very small town, and I am very passionate about dentistry, so those who know me can relate to this sentence. Thank you.
Okay. So started practice in Pune, shifted to his hometown, and 18 years into practice. And and you said that you were in the outskirts in the place called Kedgaon, which is just when you move from Pune to Aurangabad or that side. So it's just at the entry of Ahmednagar or Nagar, whatever you call it. So how was the initial phase? What kind of challenges you used to face? Patient awareness in the small places, the kind of practice you used to do, and what are the challenges specifically that you used to face in those in those times?
When I shifted from Pune to Ahmednagar, the first challenge was the rate difference, the treatment charges different, because at that time in 2007 we used to charge almost 2,000 rupees or 1,500 for root canal in Pune, and when I shifted to Ahmednagar, the people were charging 500 rupees for the root canal. So that was shocking for me. So I joined IDA Nagar and worked as a EC member. Then slowly I became secretary. I gathered all the members, and first time in Nagar we made a professional charges list. And believe me, every everyone was happy. There are few people those who don't agree, but most of the people agreed, and they till date they thank me for making that change, one change in this thing. But it was very challenging in small town, getting root canal, patient for root canal also. The people used to come and get the tooth extracted. It took me almost 2 to 3 years to build my root canal practice. So it was basically a extraction and RPD kind of a practice in the initial phases.
Okay, yes. And I can very well relate to it because I used to practice it, dentistry, in even a smaller town of 50,000 population, my hometown, Pachora. And primarily the practice was extraction, RPD, dentures, and silver fillings. And sometimes, crown bridge work was there. You really used to take lot of time. It was very hard to convince patients for root canal. Forget about implant and also is out of question at that time. Okay. It was extremely difficult. And as he rightly said, that charges was always a big difference actually. Okay. And a big challenge. By the way, those of you who practice in the small places, how many of you think charges is still a big problem? Okay. So type yes in the chat. So, and I'll tell you something. There are two things which I want to share here. Number one, when you practice in the small town, you have that, somewhere at the back of your mind, you have that, whatever you call it, mental block, inferiority complex, that I practice in small town. I cannot charge a lot. People cannot afford it. People don't have money. Barish nahi hua, and so on and so on. So you have all these things at the back of your mind. Okay. Now, interestingly, it's never like that. I always say this, right? Your practice is just the reflection of who you are. You need to work on yourself rather than your practice. You need to work on your mindset. You need to work on your skill sets. Second, in these small towns, another reason, because the mindset is such, not just of yours, but people's mindset is such that, it's going to be an average dental experience. So you start the practice and you start the average practice. Your clinic interior is average or maybe below average because you don't just even give any importance to it. You don't give any importance to it simply because you're like, even if I make a very good clinic, how does it going to make a difference? I'm still going to get 500 rupees. But I'll tell you what, it's always about price versus value. You need to add massive value to your practice in terms of soft skills, domain skills, upgradation, and the game starts changing. So as you were facing these kind of challenges, how things started changing for you?
So first of all, I changed my mindset. Let people charge whatever they are charging. People should not decide my charges. I will decide my charges. And I started doing all the courses, the basic implantology course. Then I did microscopic, basic root canal course, then microscopic root canal course. Every course I keep on upgrading all the time. I do just if I get to know if there is course going on, so I just jump in. I don't think, I not even think for a second to put that money, because learning is everything. Your knowledge is everything. So I kept on upgrading myself. I did my first basic implant course in 2010. At that time, implant was not even dentists were aware of implants in my area. So they told me, यार क्या कर रहा है ये, क्यों कर रहा है implant का course, कहाँ से आने वाला patient. So when I started telling patients about implants, they used to run away from my practice. They used to go to my nearby dentist and get the bridge done. But still, I hold on. I kept on upselling myself, keep on telling the patient the positive things about the implant, that we don't need to cut your adjacent tooth. Tell them the importance of the natural tooth. And slowly, it took me almost 4 years I first did my first implant in 2011, and it took me 4 years to put my second implant. So it was that difficult. And now I am doing implant on a daily basis, just like a root canal.
Awesome, isn't it? Guys, imagine. So there is a very powerful learning here from what Chede sir shared. Imagine you doing first implant, like you do that implant course and you are fully charged up and you literally land up getting that first patient out of your sheer energy and motivation. But guess what? The reality sets in, okay? Life and your place sucks you in the routine, and it took 4 years to get that second implant case. By the way, how many of you have done that one or that first implant in your practice? Whether you have done it or your implantologist, but how many of you got those first few implants or one implant and then it becomes a challenge for you to get that next implant patient? And you will be surprised, there are many. Okay. So the point is, this is how it happens actually. But what is very, very important is you don't have to give up. That's it. You don't have to give up. Now, Ahmednagar, 2010, 11, talking about implants, where in the metro cities also, people were hardly doing implants. Okay. But he was ahead of time. The only thing that kept him ahead of time was constant upgradation. Okay. So you keep on upgrading yourself. Most importantly, you don't give up because you are ready. The market is not. It happens sometimes, I'll tell you. Okay. But the best part is you are future ready. By upgrading yourself, by having the right mindset, you keep yourself future ready. And when that right time comes, you're the one who can kill the show. And as you said, doing implants on daily basis, just like root canals, right? So things started rolling from 2014 onwards. How, when you hit us, this community?
So it is a long story. One of your friends, Dr. Omkar Kulkarni, and few of us was enjoying party at Konkan, and suddenly he told कि यार मैंने ये life excel course किया है सर का. So everyone wanted to do that, but no one was telling in front of each other कि यार मैं बोलूंगा तो ये इतने साल के बाद ये सीखने की क्या जरूरत है. Everyone wanted, because all people with me were almost practitioners like 20 years, 25 years, and उनको यार कैसे अभी बोलूं. And that day everyone told कि यार मुझे भी करना है, मुझे भी करना है. So first module was done for that year. So we requested sir, and he took that module for only 7 or 8 of us. He arranged the date for us, and then we joined. So that was, I am very thankful to Omkar Kulkarni sir and all the members who joined with me. So it made a very big difference, not in terms of practice, but overall my life changed, because I was doing all the things like sir telling his courses, but it was not properly arranged. So sir gave me all the ready-made recipe, and there was a small mind block कि यार अभी चल रहा है, अच्छा चल रहा है, क्यों अपग्रेड करना है, अभी क्यों बड़ा क्लिनिक करना है. And in 2019 I joined Life Excel, and that gave me a big kick कि यार तेरे मन में जो है to make a big practice, so let it be in a small town, let it be in a outskirts area, तेरे मन में आया है तो do it. And I personally talked with you sir, and you told me just go for it. And right now I have a 2000 square feet ka clinic, and almost each and everything in dentistry, from root canal to milling machine, correct system in my clinic, CBCT and all. So it is like that, and from that I never look back.
Okay, wonderful. So now, quite a few things here, by the way. The first thing is many times when you're like, 10, 15, 20 years into practice, when it comes to learning something new, the biggest resistance always comes from within. Okay. Number one, I don't need it. Number two, I know everything. Number three, what can he teach me or this course can teach me more? I have seen enough of dentistry. Number four, log kya kahenge? Okay, so all these resistances, by the way, how many of you have faced these resistances? Type me in the chat box, okay? So this is so common. Interestingly, learning, always remember this, guys, learning never has an age. You can learn at any age, any stage in your life. Okay, learning never has an age. Like you don't need an, इस उम्र में आप नहीं सीख सकते. It's nothing like that. You can learn new things in any age, any stage of life. And with all honesty, the older you get, frankly, if you ask me, the more you need it. Because, you actually become, your vision becomes from total vision to tunnel vision. Like I do this, I know this is the success formula, and I have to keep on doing this for the rest of my life. So, you ask any 20-year-old how much money you want to make, how much successful you want to be, and he and she will talk about, I want to make like 5,000 crore, 1,000 crore, 100 crore rupees. I want to be like Mukesh Ambani, Mark Zuckerberg, Jeff Bezos, and Elon Musk. You ask this to a 40, 50-year-old guy, and he's like, nahi, money is not everything. So, unfortunately, as you go through life, many times, if you don't keep that vision intact, if you don't keep your vision as total vision, eventually it starts getting narrowed down to a tunnel vision. And being a dentist, one of the biggest problem is, I always say this, there is something called as law of confinement that applies to dentists and dentistry a lot. What do you mean by confinement? Over a period of time, as you practice, you get confined to a very small thing. Why? Very simple. We are dentists. We practice in our 100, 150, 200 square feet operatory throughout the day. So you actually get confined to a small room apart from the large world that you have around you. Then in that small room, you practice in that small mouth. So eventually your eyesight and then eventually your mind and your vision gets confined to that 2, 3, 4 centimeters. Not just that, in that mouth, you start working on that tooth. Your vision becomes even narrower. I'm not joking. Your vision becomes even narrower because all you see is that one single tooth at a time. How many of you agree that it becomes very difficult for you to talk about a full mouth treatment to the patient? I'm not talking about FMR. May it be 10 restorations. True? Simply because your vision is now so confined to, you just see that cheap complaint, that's it. Then, in that tooth, you start seeing only those millimeter wala root canals. This is the law of confinement, which literally narrows down dentist's vision like anything. With all due respect to everybody, not just here, but in our field, I'll tell you, I've seen so many dentists bragging about their 3 lakh rupee a month practice. I just feel sad. Forget about money again. You're not exploring your potential. You're losing on it. The world needs your help. There are so many people who need a good dentist. They are not finding a good. It's like, your matrimony ka time, your shadi ka time. Good guys don't find good girls. Good girls don't find good guys. Everybody is wandering, directionless. Somebody asks how to get rid of this. The answer is being here. Trust me, because it's all about your mindset development, nothing else. Your practice is a reflection of you. Your life is a reflection of you. Okay? So just change this. Upgrade yourself. And as sir said that, imagine like, a 2,000 square feet facility. In-house CBCT, in-house scanner, in-house CERAC. What else you want? But he didn't mention from where it started. How much was your first clinic? What was the size of your first clinic?
My first clinic was almost 110 square feet, including reception area. My first month ka collection was 11,000 rupees. I still remember.
Okay. So,
And
yeah, please go ahead.
I joined Millionaire Dentist Hub, and at subconscious level, I became millionaire, sir. I subconscious. I never thought ki I will earn that much of money. And as always, you always say, money is always a byproduct for me. It is always a byproduct. You should focus on your work. Money will keep on coming. You have to stop. बस हो गया भाई अभी. Abundance will come to you. So this is how it is.
Superb. Imagine, boss, a typical, like every dentist, I told you, see, unless you get a big practice in legacy or something, every dentist starts with that one single shop, right? That shop sometimes is 100 square feet, sometimes 150, sometimes 200. That's it. Okay. And from there, you move to 2000 square feet. It takes time. It's not an overnight success. There is a very nice saying, what people call it as overnight success. It took 20 years for me to achieve the overnight success. Okay. So the point is, you just have to, one of the best thing you can learn from Chede sir is lage raho. Don't give up. Be passionate, upgrade yourself, lage raho. Okay. And how much percentage wise, how much practice growth you have seen after being part of Life Excel and MDF community in the last 5-6 years?
So when I joined, it was around 2-3 lakh rupees a month, and fortunately to say, in this month I already crossed almost 14-15 lakh rupees. So it is like that, sir.
Okay, wonderful, right? So, like, it's just 21st of April, by the way. Okay. So the point is, yeah, wonderful. So forget about, again, guys, forget about numbers. What should motivate you is if one of you can do it from 110 square feet, trust me, everybody can do it. So if you have to give top three, lessons, if you have to give top three takeaways, which probably help you to, take it to a whole new level, what would they be?
So first of all, be in a flow. Don't go outside this community. Surround yourself by like-minded people. Because whenever you go to your local area का friends के यार मस्त चल रहा है तेरा क्यों कर रहा है, so don't just keep them aside. Keep in this group. Keep motivated all the time. This is the first thing. Second, keep on upgrading. जैसे मैंने पहले बोला कि flow, आप उस flow के साथ चलते रहो. Keep on upgrading. Keep on learning. Don't, unless and until you die, don't stop learning. That is the only thing. This is the second one. And third one, बहुत analysis paralysis नहीं करना है. Just do it, do your best and forget the rest. These are the top 3 learnings from me.
Superb. How simple, yet how powerful. Be in the right environment. Keep on upgrading yourself till the last breath of your life. And do your best. Forget the rest. Abhigan says, if I do courses, I don't get patients, I'll forget everything. No, it doesn't happen. You keep on reading, you keep on practicing on the extracted teeth and all. See, I'll tell you, Abhigan, where there is a will, there is a way. Okay. Never think that I cannot do it in this small town. It is not possible. Everything is possible in this world. In fact, the best of the things in this world are always done by the people who wanted to do it no matter what. Whether you're in Ailanagar, whether you're in Pachora, whether you're in whatever. So it's not just about our stories. It's about everybody's story. You look around and you will find thousands and thousands of people creating something big out of absolutely nothing. You don't always have to be an IITian. You don't always have to be a university topper. You don't always have to be a son of, who's who. No. In fact, many times they just can't do it. All you need is that fire in your belly, the right attitude, and I'm going to do it no matter what attitude. So, sir, what would be the final message you would give to everybody so that people get inspired? Because a lot of people have now decided to make their annual revenue as monthly revenue. Okay. So what would be the last message?
अगेन जैसे मैंने शुरुआत की थी वैसे एंड भी करूंगा। एक दोहा बोलूंगा सर, खाली न बैठ कुछ किया कर, खाली न बैठ कुछ किया कर, भले ही अच्छा पैजामा फाड़ के फिर से सिया कर। So guys, keep on learning, keep on upgrading. Don't be in that comfort zone कि अभी मस्त चल रहा है. Don't. I'll share one of my thing कि in implantology I did all the courses. When I joined a bicortical implant का course, people fool me कि यार क्यों कर रहा है, basic implant बहुत अच्छा है, bicortical. So at least you should know what that system is. You should not blame anything unless and until you know about that. Everyone is blaming right now for bicortical implants. It is not like that. There are some cases who need bicortical implants. Just you have to know where to put this implant and where to put all other implants. So you should know each and everything. I spent 50 lakh rupees on learning implantology.
Look at this, guys. And powerful, isn't it? Very, very nice share which he shared with you. And it was just like, be in the action mode. Simple. Have the open mind. Don't blame anything unless you know everything about it. Okay. So always keep your mind open. Keep on learning all the time and keep growing. And most importantly, keep on enjoying life. Because life is not just about making money. Life is not just about doing practice. Life is about living a profound life, creating a movie which will be worth seeing when you turn back toward the sunset of your life. With this, let's conclude this Speaker X session. Congratulations, sir, once again. Keep growing, and this is just the beginning. Okay, अभी तो नापी है मुट्ठी भर जमीन, सारा आसमान अभी बाकी है.